Okay, just found out this afternoon that the nursing home that my dad is in is ending their Medicaid contracts. And he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contracts, because even though they lose money per resident, the majority of the beds are filled with Medicaid long-term patients. So why would you end those contracts? You have to be in financial distress, I would think. This isn't a nursing home that is anybody's first choice. Okay, you're only going there if you couldn't get in anywhere else, or there wasn't any room anywhere else. That's kind of how we ended up there. Plus, it's only like one of two facilities in Memphis that has in-house dialysis. And at the time, my dad started dialysis in the hospital and was really sick. He could barely move. I mean, he's able to walk now, and he's, it's a miracle what he can do now. But so we thought that would be, the easiest thing for him at the time. So, I mean, just going down the rabbit hole, it seems like this facility is in financial distress, maybe going to close. I don't know. The company that owns this nursing home owns 5 throughout Tennessee and Kentucky. It has an above average staffing shortage, nursing staff turnover rate. So at 55%, it's a 1-star nursing home. So, I mean, why else would you end Medicaid contracts? Maybe it's as simple as getting less money. I don't think it's because they're trying to restructure and make more money from skilled beds, because I'm telling you, that's not anybody's first choice. It's no. So yeah, can anyone enlighten me? Is this happening anywhere else?
I just saw a video of a woman in Tennessee whose father is being taken out of his nursing home starting September because of Medicaid cuts. And she doesn't understand why it's happening, because it's something called Blue Care in her state. And I don't think she made the connection that Blue Care is Medicaid in Tennessee. And she's like, it's a 1-star nursing home. It's not a good nursing home, but it's the only one that has dialysis. Well, I don't know what to tell you. I voted for this woman's best interest. And, a lot of the MAGA people have come at me for saying that these tax cuts are going to benefit billionaires, but it's already starting. The ripple effects that people think are starting in 2028, they're starting now. Now.
Good morning, I guess. It is Friday, August 1st. Let me tell you what I got in the mail yesterday. So, for those of you who are on whatever your state Medicaid is, I am on it. And it helps me pay my 20% and my premium for Medicare. And just to give you a little bit of a background, I suffer from migraines that are a result of having chemotherapy and radiation. It took 2 years worth of treatment to get my migraines under control, to get approved for some medications. One of my medications is for breakthrough. It is $982 a month. The other medication that I take for migraines is an injectable, and it is just under $1,800 a month. So I just got in the mail the letter. They reevaluated my Medicaid, and as of today, I no longer have Medicaid. I no longer can afford my migraine medicine because I cannot afford the 20% I have to pay every month. I can't afford that. So, and I work. I don't sit on my ass. I fucking work. Matter of fact, I've been working overtime this week to the tune of 18 hours. So, MAGA, when you think that this is not going to affect you and not going to affect grandma and grandpa in the nursing home, think again. Washington has made y'all believe that recipients of these programs are lazy and sitting at home on their ass eating bonbons. That is not the case. I am literally on my way to work right now. And I literally just left work at 9 o'clock last night. And it is just before 6 a.m. Friday morning. And as I go into work this morning, I cannot stop thinking about, I'm supposed to pick up my medicines in the next couple of days. I don't know how to do it. Don't know how I'm going to afford this. Anyway, peace. Try to have a good Friday.
Really quickly, because I have to get ready and go to work, but I want to tell you what's going to happen in the next couple of years with Medicaid. And one of the things that you should be preparing for if you live in a large urban space or like a suburban space with a robust healthcare system. Hi, my name is Evan. I'm a bioethicist and I specialize in misinformation, disinformation, and conspiracy theories as a threat to public health. So at work yesterday, we learned about the Medicare cuts rollout. And what we learned is that they're set to really go into effect just after the midterm elections next year. So sometime in like November, December in 2026. And this is always intentional. This is intentional. And the reason why this is intentional is because when it comes to the last several years in politics, number one, you have to wait till things to expire. So it's not always like we're trying to get the other guy or trying to get the oppositional team, or, you know, how politics is played these days. But in this instance, there's a lot of intentionality of this rollout because they weren't set to expire, not in the way that they're being rescinded and reduced. And so the idea is that if you have Democrats getting sort of a blue wave in the midterms, by the time we get around to like the presidential election again, these cuts that would be devastating and will be devastating can be blamed on whatever the leading party is that wins in the midterms. And so that is like a sort of safeguard that has been put into place, I think, as like a sort of weird political technique. It's like we won't be blamed when this all goes down, right? Especially if the Democratic Party then is trying to figure out ways to intervene or try to reduce the impact. And so they are working on it legislatively, but there's still decimation, which there will be, right? So I think we all need to have a conversation with ourselves, generally as a population, about picking political representatives that are not going to do these horrible things when it comes to policy and legislation, and especially funding across our governments, and then be doing them in a way and executing them in a way where they can't take responsibility. You know, there was a time, I can't remember that time, but there was a time where any type of politician, or most politicians, were more than proud, no matter how awful or great their legislation and their policy was, to take responsibility for those things. And it's because they really believed in them, and they weren't using them as sort of like technique to regain power or stay in power, right? So we have to think about that critically, because it's really terrible. And I know what was what happened between 2016 and the first administration for Trump, was that Obama spent 8 years in office trying to, repair this damaged economy that was, obliterating people's jobs. People were down so bad. High unemployment, like all of these things, right? And by the time what he put into place went into effect, it was Trump's presidency. And people believe it that way because we grew up with the design or the model of immediate satisfaction, right? So if something's happening to us that's good, that's happening right now, we look around at who's in power now and go, oh, they did it. And that's not how, especially at the federal level, politics work. Frequently, you're suffering from something that someone else did. Like everything that we're experiencing when it comes to support programming funding and welfare, or social welfare programs, and the decimation of them is from Bill Clinton's era. And I'll never let us forget it. I'll never let us forget it because I hate that man. So with these Medicare, Medicaid cuts, what is going to happen is that there are a number of health systems, predominantly rural, that depend heavily on Medicare being a payer for individuals who are underinsured or uninsured completely. And that means that these healthcare systems are kept buoyant. That is how they pay their bills. They're not paying their bills from all of us who are insured. That's not happening. At least not in the way that they need to sustain all of the service provision that they provide, or all the service provision that they execute and give. And so in my state of Pennsylvania, healthcare systems like St. Luke's will be crushed with this. Even though they specialize in other things, they're not just specializing in impoverished care. You can't help it in rural space because poverty is pretty expansive, living at, below, or being working class. So that's the employment that's out in these spaces, other than working in medicine. Medicine would be where you get more middle class to upper middle class employees. So this will also affect jobs in rural space because, again, in the Poconos region in Pennsylvania, St. Luke's is one of the only major and important and sort of stable jobs in some areas. Either work everything from being a medical assistant, or doing office work or administrative work, all the way up to being a cardiothoracic surgeon. But that cardiothoracic surgeon has the money and the means to move somewhere where they still need a cardiothoracic surgeon. And we already have a depression when it comes to, or a dearth when it comes to doctors. And with less and less people being able to go to med school, that means there will be a lot of job opportunities for people who specialize in medicine. So the people who are in medicine already are going to be able to pick. Maybe they don't want to move, but they'll have to, but they'll have the means to. But the other thing that's going to happen, because a lot of people are talking about rural healthcare closures, that's going to occur. And we've already seen a big issue. There's already been a big issue with rural healthcare systems experiencing concentration, right? Being subsumed by larger hospital networks and systems, and then managed from afar, or being subsumed and being consumed by private equity, right? So this is not too new. It's just going to be supercharged. But the thing that happens in these instances, especially for people who are managing chronic conditions like HIV that have all sorts of clinical care allowance and are funded separately from Medicare and Medicaid, even though people who have HIV also utilize Medicare and Medicaid, is you are going to see migration, national migration inside of states predominantly, for people from rural areas or suburban areas moving into urban space to access these more robust healthcare systems that figure out ways to survive this decimating event of loss of this funding. There's just more there's more diverse funding or varied funding in areas where there's more people, right? More people have insurance, more people pay out of pocket or whatever. There's more donorship. And so those spaces will still have their healthcare systems intact. They won't be obliterated or closed. Except for ones like Temple Health. Temple Health will most likely really, and that's one of our main like trauma centers here in Philadelphia. They're one of the only ones that knows how to deal with weapons wounds, firearms wounds. And so, but that system majorly caters to a very impoverished population that uses Medicare and Medicaid. But for your urban health systems that stay intact, you're going to see a lot of people who may have had low income employment and stable housing in more rural spaces where it was affordable start to migrate into urban space and become destabilized in their housing and unemployed simply because they're able to access better health care at the cost that they need it to stay alive. And so in the coming years, this population of people with housing insecurity or housing issues, more so than what you're seeing now, and people who are underemployed or unemployed, or are being experiencing exploitation in their employment in a variety of ways, either under the table or illegal employment, all kinds of things, that population will grow in the next 5 years. And they will become the target marginalized population for sure. And so I think it's very important that we all start to prepare for those of us who exist in health and clinical systems that are most likely going to absorb this movement, because this happens before. It happens all the time when opportunities, end or come to an end. People move where there is opportunity or possibility because people want to stay alive. So
UCare has withdrawn from Medicaid, impacting 11 Minnesota counties and around 88,000 Minnesotans. This will impact those that are on prepaid medical assistant program as well as Minnesota Care. However, seniors or people with disabilities will not be impacted. The 11 counties that they are withdrawing from Medicaid from are Benton, Chisago, Crow Wing, Pennington, Ramsey, Roseau, Sherburne, Stearns, St. Louis, Wallina, and Wright County. They said they are withdrawing from these 11 counties because there are 2 other health options available through Medica or Blue Plus, and they will start helping people transition to these plans. UCare said in a statement that they are not getting the reimbursement that they need from the government to cover the rising costs of healthcare, and being enrolled in Medicaid at this point is not sustainable. As we know, rural areas get hit the hardest when healthcare costs rise because most people in rural areas are on Medicaid. Medicaid is what keeps hospital doors open. However, if health insurance companies are losing money drastically, they will unenroll from Medicaid, leaving people without health insurance and ensuring that hospitals in rural areas will shut down because they simply cannot afford to stay open. Now, this will probably be an even bigger trend come 2026 when those Medicaid cuts come into play from the big, beautiful bill. Minnesota is set to lose $500 million in federal funding for Medicaid, which is going to have a huge impact on healthcare here in Minnesota.
I just came out here to tell y'all that I work for Medicare. And the changes that Trump is making, oh dang, can I probably not say his name? Anyways, the changes that he's making is real life. They are cutting people's Medicaid checks, no letter, no explanation. They are increasing their Medicare coverage premiums. It's like the only result is that they're trying to, all the elderly. I literally had a man that was getting a transplant, got the clear on Friday. Yesterday on the 1st, they cut everything, cut his Medicaid, cut his SSI. He can't get anything. So he cannot get his transplant. In 3 days, that made a change. Like, check on your grandma, check on your grandpa, your mama, your daddy, because they're going through it. And it's really sad.
Yes, Trump's voters will be the ones most impacted by cuts to Medicaid. Red states, especially rural area in red states, receive a disproportionate amount of Medicaid funding. Mississippi and West Virginia receive the most federal assistance for Medicaid, and these are the next highest: Kentucky, Alabama, South Carolina, Arkansas, and New Mexico, all of which voted for Trump except for New Mexico. The lowest rates of Medicaid use are all in blue states, with the exception of Wyoming. Red states also have much higher rates of disability, which is usually tied to Medicaid. The biggest concern is probably about the rural hospitals, which mostly get their funding from Medicaid in Republican states. Those hospitals will close. And that is why some of the more moderate Republicans are opposed to Medicaid cuts, including Josh Hawley, who wrote an op-ed in the New York Times today about how these planned cuts to Medicaid are both immoral and political. Missouri has a lot of people on Medicaid. A lot of the red states, especially the ones in the South and in Appalachia, are subsidized by federal funding from blue states, and they're about to lose a lot of it.
I predicted back in January that Trump would be coming for EMTALA laws, and people said that I was fear-mongering and that I was being delusional, and guess what? He signed an executive order getting rid of EMTALA. So what does that mean for you? That means that if you go to the hospital and you are in a life-threatening condition, if you are in labor, they can now turn you away because of your inability to pay. It's because they don't get Medicaid anymore. Do you see how all of these things wrap around into each other? If they don't have Medicaid funding, then they cannot offset the cost of people who cannot pay. If you cannot pay, they can now legally turn you away. So if you show up in cardiac arrest and you don't have your insurance card on you, they don't have to treat you technically. If you show up and you're in labor and you're like crowning, but you don't have in-network insurance, they can make you leave. They don't have to stabilize you. They don't have to treat you. That is the whole point of EMTALA, is so that everyone can receive life-saving care. So if you show up to the hospital and you need life-saving care or even non-life-saving care, but you can't pay, they can now turn you away. These are the real-life consequences to things that are happening above us.
This is what our shitty-ass healthcare has come to, where my patients need medicine and supplies and their insurance won't cover it, and here I am spending my own money because my patient needs it, and he doesn't have any money and he can't work. And the insurance won't even cover what he needs. And I'm sad and I'm sick and tired of it.
Doctors in America are now telling you to go to Mexico. It happened to my boyfriend today. We went to the emergency room. He's been having really bad gastrointestinal issues. Doctor literally told him, we can only do so much. You should probably go to Mexico if you want to have any more tests, son.
It's so crazy. So crazy.
It's so crazy.
Go elsewhere.
Yeah, that's pretty much what he said. There's nothing that we can do for you. You need to go elsewhere. And people, like, Americans love to pride themselves on our healthcare, how our healthcare is top tier. It's better than any free healthcare because it's not free and blah, blah, blah. And guys, our healthcare is telling us to go to a different country.
So, the whole good thing about American healthcare is we're supposed to be able to get it quicker because we pay for it, you know?
Mm-hmm.
But I have to wait 6 months to see a GI, so I have to wait half a year to see a GI specialist, where I could then go to Mexico and see one in about a week.
Yep. For not
Like
even,
a
not,
tenth the
yeah, a
price.
tenth of the price.
It won't cost more than my insurance does.
Yeah, the doctor
Like-
literally was like, oh, if you go to Mexico, you won't have insurance, by the way. You won't have insurance. It
Yep.
doesn't cost what it does in America.
You pay the prices down in Mexico if it means they're actually going to help me, you know?
Dear Republican lawmakers, I'm an unemployed young person living in my mom's basement, and you just voted to take away my Medicaid. And you said that I needed to get a job because I'm a lazy bum. Well, here's how I became the lazy bum I am today. A year ago, I was employed, therefore I deserved health care. I was building buildings for our great nation. I was presenting research at conferences. But uh-oh, I got COVID, which developed into multiple chronic illnesses, which made me really lazy. Here's me lazily getting tested for my debilitating chronic fatigue. Here's me getting infusions because COVID destroyed my immune system because I'm so lazy. I was taking all these pills trying to maintain my job, but I was just getting sicker and sicker. Or, lazier and lazier, am I right? I got so sick that I needed to quit my job, leave the life that I had built, and move in with my mom, and it was all because I was just so lazy. I quickly blew through all my savings to maintain my healthcare, and because we're so far from a cure from long COVID, and let's be honest, who wants to fund that anyway? I had to get on Medicaid to maintain my health and keep myself alive. But now you've introduced work requirements to Medicaid to cure me of my laziness. I have the privilege of neglecting my health until it becomes a medical emergency and then showing up to the ER and then after that declaring medical bankruptcy. What freedoms? You'll probably tell me that this can all be avoided if I apply for disability, but we both know that that will take years to approve, if at all. So thank you, Republicans, for selling out my health for Jeff Bezos' next yacht, just as God intended. I'm proud to be an American.
So Trump just reversed the rule that our medical bills will go back on our credit report. Just as people are losing their Medicaid and Medicare. You know what this means, don't you? If you can't afford your medical bills due to high copays, high deductibles, no insurance, your credit report is fucked. And when you start getting healthy again, and you got a job, they can come garnish your damn wages. You know, I wouldn't have voted Democrat for shit in this election. But there was one thing that Biden did that I agreed with, and that was making that rule that those medical bills wouldn't be on your credit report. But now that they've made these changes, they can come after your life savings.
I just found out that today they passed a law in Oklahoma that says doctors and nurses can refuse treating you for their personal beliefs. I look like me. I'm gonna die here.
If you have any preventative procedures, doctor's appointments, vaccines, colonoscopies, mammograms, schedule them right now. RFK Jr. is going to make sure that none of those cancer screenings and none of that preventative care is covered on your insurance company, yes, even if you purchase it privately. This isn't just about individuals who are on the Affordable Care Act. This isn't just about individuals on Medicare and Medicaid. This is everyone with insurance everywhere will lose access to important preventative care and cancer screenings. There was a case that was brought before the Supreme Court where a conservative group challenged the coverage of a drug called PrEP. This is a drug that makes sure that HIV doesn't progress to full-blown AIDS so that you can live with HIV and not die from it, essentially. It's an extremely effective drug. It's low cost in other countries. It costs a lot here, but that is an entirely other thread having to do with the unbridled greed of the pharmaceutical companies. I digress. So the Supreme Court actually ruled on behalf of the providers of PrEP. They said that no, that in fact they do have to provide this because it was given a recommendation through this advisory board that is employed by our government. They meet periodically to go over research studies that evaluate the effectiveness of different preventative care and screening tests. And up until now, anything that had an A or B rating, peer-reviewed, was legally required to be covered by our insurance companies. So how does that relate back to RFK? Well, he's going to dissolve that board. He's firing all of them because he believes that they are too woke, and that he's going to put in his own individuals who, let's face it, probably are going to say that no, actually you don't need PrEP. You don't need colonoscopies. You don't need any of these things that cost insurance companies money because they're not protecting your health. They're protecting their bottom line. Check out Dr. Rubin's video, and if you don't follow him, he is an amazing source of information on all things healthcare related.
Imagine being a nurse in Florida and having to ask for permission to quit. That's where we are now. See, Florida's Choice Act just didn't sneak in. It slid through without DeSantis even signing it. It's one of the most extreme non-compete laws in the country. We're talking 4 years where certain workers, especially high earners, can't leave to work for a competitor. That includes a whole bunch of healthcare workers, tech folk, finance, and even executive level folks at nonprofits. And if your job decides to sue you, you can't even work somewhere else while the case is in court. So you're stuck with no income, just waiting. So y'all, we gotta call it what it is. It's a trap. This ain't about protecting opportunity. This is about rich donors like Ken Griffin helping to write laws to keep you stuck in a place while they continue to make money. See, Florida keeps selling out working people to corporations. First it was housing, then it was education. Now it's your freedom to leave a job. And folks wonder why healthcare workers and teachers are leaving red states. So if you ever wanted to know what economic control looks like, it looks just like this.
A lot of people say that Obamacare isn't as good as Medicare for all, but it's better than nothing. It's a half measure. And Obamacare did do a few good things, mostly through the expansion of Medicaid. But ultimately, it's a way to prop up the private insurance industry that was designed by Mitt Romney and a corporate think tank. It's not a half measure. Medicare for all would be a half measure. What Medicare for All would do is nationalize the insurance industry, meaning make it public rather than for profit, and then just pool people's money together and use it to pay for their healthcare, without having a middleman suck money out of that pool for their own profit, which is what we have now. Getting rid of that is a half measure. What we should do is nationalize the entire healthcare industry. The hospitals, the pharmaceutical companies, the ambulance companies, make it all publicly owned. That is what we need to move towards if we want to fix the healthcare system in this country. Not just providing a stimulus to the private insurance industry.
Hello, this is Dr. Elizabeth Potter. Who is this? Who am I speaking with? Can you not, there's also another wet. So you have two doctors on the call. Will either of you give me your name or MPI number or license number? The reference number for the call, but you won't give me your name or number, and neither will the doctor from Texas. Okay, please give me the reference number. Okay, and is the doctor from Texas? Would that person speak up, please? I'm good. Are you a plastic surgeon? What do you mean subspecialty plastics? I'm a plastic surgeon. I wouldn't say subspecialty, so. You're an oculoplastic surgeon. What was your initial training in? So we're speaking about lymphedema of the arm. So this is not an area that you're familiar with, correct? Oh, okay. Still practicing, but you won't give me your name? But you're my colleague in plastic surgery, and you won't give me your name. Yeah, I don't understand how it's connected. I understand that the CEO was murdered, right? But I'm your peer, and I want to have a conversation with a peer about a patient who has breast cancer and lymphedema, and I would like to know your name. How do I know who you are? How do I know that you're board certified and that you're a microsurgeon? Like, how do I verify that? I'm just trying to make sure that I'm talking to an expert in this procedure with training that's commensurate with that. How do I verify that? So I can get your name from United Healthcare through this reference number. I'm so sorry that this is to protect you as a doctor. I'm really trying just to do the right thing as a patient. And I also personally have been subject to, threatening communication as well. I just want this to be the right thing. Okay, so I'm just gonna have to trust you. You were asking me as a representative of United to trust you that you're a plastic surgeon and fellowship trained in microsurgery. So, okay, I'll trust you there. So do you perform lymphovenous bypass? Have you performed it yourself for patients with lymphedema? Have you performed it yourself? So have you been the primary surgeon in evaluating and performing lymphovenous bypass for a patient? Even one? You have not. Okay. Do you treat patients with breast cancer currently and do microsurgery like deep flaps or lymph node transfers or lymphovenous bypass? You have a cosmetic practice currently. Okay. Do you do microsurgical? Okay. Do you do microsurgical breast reconstruction currently? So you're not doing microsurgical breast reconstruction currently or treating patients with lymphedema currently. Okay, so the patient that we're talking about is a physician, and she is going to have an axillary dissection and radiation, and her risk of lymphedema is, I'm assuming you know. Do you know? Do you know what the No, it's important. The specifics are important. Do you know the specific risk? Like the documented risk for her? Like the percentage risk of lymphedema? No. She absolutely will need radiation. If she's having an axillary dissection, she's going to have radiation. No, so she's been to see us in clinic. She's had further evaluation. She is going to be having an axillary dissection and will need radiation. So do you know what her risk of lymphedema is? Well, I mean, I think if this is part of the issue. If you're my peer, then I think you should be able to answer that question, because that's an important statistic, certainly for my patients who have lymphedema. So her risk of getting lymphedema is 40%, and we have the ability to reduce that to 10% using a lymphovenous bypass. And that's the information that I want you to carry back to United. And I will do the appeals and all of that. But that's the piece of information that I want you to have going forward. So you don't have the ability to approve it in your role. Okay, this patient I'll appeal. Again, I appreciate your time. I don't think you're my peer in this area. I don't think that you have the specific details around this procedure. You haven't performed it yourself as a primary surgeon, and you're not actively treating these patients with microsurgery. But I appreciate your time and calling, and I'll continue to reach back out to United. You too, thanks.